about a brief introduction to pets and allergies and give you just a little bit of a mindset of how to think about your pet if they do have allergies. If you go to the veterinarian, typically what they will do, what I've seen, is they will maybe do some kind of a food trial to see if your pet is allergic to certain foods and try to rule that out. And then they might start your pet on a medication or a steroid, which is pretty extreme. So it's very rare that a regular veterinarian will really try to address the main issue of allergies, and that would be trying to figure out what the body is reacting to. So an allergy is the body's immune system overreacting to outside stimuli. And I find like pets with allergies often are very active, or they can become easily agitated, and they're just overreactive to everything in life, and their body is reacting, so they're sensitive to everything going on outside. And allergies can be triggered either they can be genetic, and that would be something acquired. A lot of times they're dogs with white coats will sometimes have allergies, and there might be a genetic component to that. We would often see white pit bulls coming into the hospital on emergency, and they would just be red and raw all over their skin. And they had never been to an allergist, and they just keep coming into the emergency room, and they've never seen an allergist to deal with these issues. The other thing, it could be just your dog's immune system when they were born. Maybe they weren't in great conditions or weren't fed a good diet, or they were nursed by a bottle instead of from their mother's colostrum, which would give them the initial immunity that they need to start life with. So all of these issues are things that happen, and we move on. But as your pet ages, and if their body is not given the chance to heal, then they may have these allergies that set them up for life. There are also acquired allergies over time, so maybe as your pet gets older, they acquire these allergies, and that could be a sign of something with their body that is just not able to process. That might just be something where their body needs to be rebooted a little bit. Maybe they need a different diet. Their body needs the tools to be able to heal themselves. So what you should do if your pet has allergies, if they're mild, you can usually try to deal with them on your own. Most allergy veterinarians have told me that allergies typically come from the environment, and things like dust mites, pollen, material in your couches and carpets. So these are things that are really, really hard to get rid of. I had a dog that actually showed up positive in an allergy test for humans and cats, plus trees and pollen and grasses. So basically she was allergic to the world, and she was a very overreactive dog. And we controlled them with allergy serum. So we had her tested, and then we were able to put her on the appropriate allergy serum to really control these allergies so that she was not overreacting. And then over time her body changed, and she was no longer allergic, and we didn't have to give the serum anymore. So you want to start with making sure that your pet's immune system is really strong. So feeding them a good diet. If your pet has allergies, starting with maybe a home-cooked diet as a trial just to see how they do. And a lot of pets react really well to that, and their allergies almost go away completely. From there, you can make sure that your pet is getting the proper omega fatty oils, so things like fish or even a supplement of that. You can add things like anti-inflammatories like linden or turmeric to their food. Those would help with the itching part. And then if your pet is really allergic and you want to try to get their body to minimize the allergy over time, you can try something like nettle leaf. Nettle leaf has properties in it. They have a lot of nutrients in them and a lot of minerals, and it really helps to replenish the body, basically acting on the kidneys and supporting the kidneys, so that the body is addressing these outside elements coming into the body. So nettle leaf works over a long time, and you would have to give it daily over time. Sometimes 8 months to a year you'll see results, and it may actually completely get rid of your pet's allergy, but it would be a test. So in the meantime, if your pet has allergy symptoms where they're chewing on their toes, they have ear infections, they have an itchy mouth, they have drooly eyes, itchy skin. You want to address that also at the same time that you're dealing with the internal. So basically, when your pet gets allergies, their body is at a disadvantage, and yeast can build up, typically between the paws, sometimes in the ears, and on the skin. And once they start scratching, they are damaging the skin cells, and they're allowing bacteria to grow on the skin surface. Once that happens, then they are prone to infections. So one of the first things the veterinarian usually does is address these outside infections. Sometimes they put them on antibiotics, or you can address them externally by putting certain lotions on. Naturally, you can use something like witch hazel to stop any itching. It's an astringent. It can help with that, as can yarrow. So yarrow is astringent. It helps with itching, and it also is antibacterial. You could use dilute apple cider vinegar to get rid of any of the yeast. And if you actually smell your pet's paws or their ears and you smell yeast, then there is probably a bacterial infection that's brewing or that's going to come about soon. So do that daily. When your pet comes in, clean their feet off. Daily, just wipe the outside of their ears with the witch hazel or apple cider vinegar or yarrow, and keep that under control. If your pet's skin is itchy, you might have to give them a bath once or twice a week just to keep that under control. If you have a small pet, you can just wipe them down with a cloth. But you really have to keep on top of this. The next thing is breaking the inflammation pathway that goes between the itchy spot and the brain. So once a pet starts itching, just like if you have an itch, you just keep scratching. And even when the itch is gone, a lot of times you keep scratching, and that's because there's a pathway that goes to the brain that says, keep scratching, I'm itchy, and then the brain says, keep scratching, then there's still an itch and you still feel stimuli, and it goes to the brain. So you have to break this pattern. And what steroids do is they decrease the inflammation internally, but they also are very taxing on the body. There's also a medication called Apoquil that a lot of veterinarians will prescribe because it stops that pathway. And it's very specific to the itching pathway. And the problem with Apoquil is that it's very taxing on the liver, and pets that go on this, I've seen their liver values on their blood work skyrocket, and the owners have to take them off it. So it's not a great long-term solution. If you have a pet that is so itchy and miserable and doesn't sleep or ever rest, it might be something that you'll need to try for a short term, but have another plan in place where you're trying to build the immune system and you're dealing with the outside itchiness with some of these natural remedies. There's also Benadryl that you can use. That might make your pet a little sleepy, but it will stop the itch. And there's also some veterinarians recommend Zyrtec, so an anti-allergy. But make a plan that when you start these things that you're really going to address the itch in other ways so that you can get your pet off of these things, or you only use them when absolutely necessary. So once you've addressed the internal itching and try to get that under control, and the external itching, you want to deal with long-term allergy issues. So I think the nettle is a good solution to that to try. There's also something called quercetin, which I forgot to mention. Quercetin is a natural Benadryl, and it's a component of linden tea, which is anti-inflammatory. So you can either try linden tea or quercetin. These natural remedies are very slow, so they are gentle, which is why we like them for pets, but they're very slow working, so you really have to stick with them and be on top of them and give them pretty regularly. Nettle leaf is something that you can use to really help restore the body. And you can either make a nettle leaf tea, which is in the library how to do that, and you can give that daily to your pet, or you can use freeze-dried nettle leaf, which you can get over the counter or online, and give this to your pet. And you would just watch over the next few months up to a year to see if this is really helping with your pet's immunity. So I usually recommend starting slow and opening up the capsule and giving a little sprinkle on their food daily, and then increasing it up to a dose of whatever's recommended on the label, and keep doing it. And I've seen this actually work over time, but like I said, it takes a long time, so it's hard for you to really gauge. It's good to keep some kind of a diary of what your pet's symptoms are over time so that you can really see if these things are working. And then as far as going to seek out a veterinarian, I would really recommend seeing an allergist for this. And what they'll do is they may recommend all the medications. They'll help with the inside and the outside, which you have to address. And then you may have to push a little bit to actually get allergy testing. There's blood work that you can do to test for allergies, which they typically don't love to do because they're not as conclusive. And then there's a test that you can do where they actually have to shave a square on your pet's body and they inject possible allergens in sequence and see which raise up into a welt. And if anything raises up into a welt, then that's positive for an allergy. And from there, they can make an allergy serum that you would give to your pet. And these allergy serums can be either internal, where you give daily, twice a day, on the tongue. It's like a drop that you put, and that has to be given consistently every day. Or it can be in an injection that you give weekly. So those are two methods that work very effectively. And you might have to really ask for that, because a lot of people don't want to go that far. They just want to give the medications and be done with it, when they're not really addressing the real allergy problem. And I've had 2 dogs in my life who have had really severe allergies, to the point where they were making themselves bleed, shaking their ears, there would be blood on the walls, scratching their mouths, there would be blood coming off of it. And the allergy serum worked really, really well for them. And over time, their body adapted and changed, because the body is always changing, and that's the good news. The body is regenerating and making new cells, and so it's renewing itself. And you can strengthen the kidneys and the liver, which help with allergies, and over time your pet can heal from this. So if your pet does start on an allergy medication, watch them. And sometimes if you're giving the allergy serum, you can, maybe after a year or two, you can actually gradually give it over longer and longer periods. So if you're giving it daily, you can maybe skip a dose. If you're giving the weekly injection, you can maybe go a few days longer than you would normally, and you can start really seeing if they need it anymore and test it out that way. So I hope this helps you and your pet with their itchy allergies, and we'll see you soon.